Ebola, a viral infection that students read about in textbooks, barely a paragraph, rarely a manuscript, no national meetings, just a word that has struck the lives and the focus and the anxiety across the United States and around the world. Originally starting in West Africa, in small rural communities, spreading to urban centers, infecting thousands, killing thousands, and projecting to take the lives of nearly 1 million people before this epidemic is over, crossing the oceans, spanning all of the continents, and bringing the state of Nebraska, the city of Omaha, and the University of Nebraska Medical Center and Nebraska Medicine to the top headlines, not only here, not only in the United States, but around the world. In 2005, we cut the ribbon on the biocontainment unit here at the University of Nebraska Medical Center. Many thought it would never be used, that it was the rare infection or the isolation of a traveler or somebody coming in from other parts of the country. But now we know that reality has occurred and that we've not only cared for one, but two, and possibly many others as time evolves. We now know that these are not only patients that are tragically infected halfway around the world, but are infected here in our own cities and in our own communities, whose children attend our schools and whose parents attend our churches. Join me as we take a video trip through the history of our biocontainment unit.
Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it.
As you know, it has affected several countries now, and this is of concern.
The biocontainment unit at the Nebraska Medical Center is one of 4 in the United States.
The idea was that we could give this person first-class care in an environment that provides for optimal safety.
We were contacted by the United States Department of Health and asked if we would participate in the care of an American physician who was diagnosed with Ebola.
His flight landed minutes ago. 51-year-old Rick Seka will be treated in an isolation unit at the Nebraska Medical Center in Omaha.
This is completely consistent with the mission of the Nebraska Medical Center.
Some police escort as Dr. Saker is making his way from Offutt Air Force Base right now to the Nebraska Medical Center.
The third American aid worker to be infected with Ebola is sick but stable.
We were scared. We were scared.
The tough nature of this disease is just the fact that there isn't any notable therapy.
So we're learning not just by watching him and treating him, but also by his descriptions.
We've been cared for on every level by the physicians, the nurses, the administrators, everyone at this great institution. Nebraska really should be proud.
Nebraska 1, Ebola 0.
Hugs and smiles today at the Nebraska Medical Center. For the first time, an Ebola patient walks out of the biocontainment center with a clean bill of health.
The CDC has declared me safe and free of virus. Thank God, I love you all.
I just wanted to tip my hat in particular to our team, nurses, RTs, and techs. You were boots on the ground 24 hours a day. You acted with courage and compassion, and I'm very proud of every one of you. Thank you.
I am so grateful. Thank you so much. And you all have made me feel so welcome here that I am now an official lifetime Huskers fan. Go Big Red!
Good evening, I'm Brandy Peterson. By this time tomorrow, Omaha doctors will be treating their second patient with the Ebola virus.
An American stricken with Ebola is in the air traveling to the United States for treatment. Ashoko Mukpo arrives Monday at Nebraska Medical Center in Omaha.
Let's start on a Monday morning with our top story, concerns over Ebola in America. A plane carrying Ashoka Mukpo, the photojournalist who was working for NBC News in Liberia, he'll be treated for Ebola at a hospital in Nebraska. NBC national correspondent Kate Snow is in Omaha with the latest on this. Kate, good morning to you.
Good morning to you, Matt.
I can inform you now that we are presently treating the second patient infected with Ebola virus here at the University of Nebraska Medical Center.
He's enormously relieved to be here. Of course, it's still quite frightening, but he's hanging in and he sounds very strong.
Hospital officials say 33-year-old Ashoka Mukpo has shown a modest improvement since arriving at the Nebraska Medical Center with the Ebola virus on October 6th.
He is seriously ill, but he's stable, he is conscious, he is awake, he is conversing.
The Omaha patient is doing better. And we heard today from that patient. Ashoka Mukpo is on Twitter this afternoon, first saying, "Feeling like I'm on the road to good health." We'll be posting some thoughts this week. Endless gratitude and good vibes.
So what we want and need is similar to what you find at Emory in Nebraska. Nebraska has sort of become the gold standard for us. So that particular type of equipment, hazmat suit, respirator masks, and then the buddy system where we can watch each other don and doff, each one make sure the other's seams are taped, that kind of thing.
It's very crucial that there's transparency. We learn not only what went wrong, but as we're learning from Emory and from Nebraska, what went right, because they're now spreading out, they're distributing protocols. I saw them this morning about exactly how to do the PPE, for example.